Hi, my name is Maria Flitto, and I'm going to demonstrate how to take vital signs. Hi, my name is Maria. Nice to meet you.
Hi, I'm Joseph.
Nice to meet you.
Nice to meet you.
I'm an occupational therapist. Do you know what occupational therapy is?
No, I do not.
So occupational therapy is a health profession that we assist individuals who might have an injury, a disability, or a mental health diagnosis, and we help them regain independence, or we help them complete occupations that are meaningful to them. We can work in a variety of settings, such as clinics, rehab centers, and schools, and we can work with individuals who are infants all the way to the elderly. So to start with your vital signs, the first thing I'm going to do is take your blood pressure. So in order to take blood pressure, you need a blood pressure cup and a stethoscope. So the first thing you're going to do is you're going to open the blood pressure cup and place it on the left arm for your client, and you want to make sure the client is seated and that their arm is about at heart level. So I'm going to strap this on. And you want to make sure it's about an inch above the brachial artery. You want to make sure it's put on tight, but you don't want to like suffocate them. There we go. Okay. So the brachial artery is on the medial side of the arm. So you're going to take the stethoscope and you're going to place it right over the brachial artery. So normal blood pressure is 120/80, so it's systolic pressure over diastolic pressure. So when you're taking blood pressure, the first time you hear the beat of it is your systolic pressure, and then when you stop hearing it, that's your diastolic pressure. So we'll give it a try. And make sure this is turned all the way to the right. Then you're going to pump it up to about 180 and then slowly release the needle, turning it to the left. So I got about 115/80, so he's normal blood pressure. It's good for you to know. Good job. So next I'm going to check his heart rate. So heart rate, normal heart rate's is 60 beats to 100 beats per minute. In order to do this, you're going to place 2 fingers over the radial artery, which is on the side where your thumb is, so the lateral side of the arm. And you're going to place it 2 fingers over the radial artery for 30 seconds, and then whatever number you get for beats, you're going to times that by 2. So we're going to get our timer going. Feel it? Okay. So I got about 35, so then 35 times 2 would be 70, so your heart rate would be 70, which is normal heart rate for a young adult. So for respiration, normal respiration rate is 8 breaths to 16 breaths. And normally you would do this when you're checking their oxygen saturation, but we don't have the equipment here to do that. So what you would do is when you walk in and you're doing the oxygen level, you would just watch how many times their chest rises and falls within 30 seconds. So I'm just going to demonstrate it even though I don't have the oxygen. So just breathe as normally as you can. 30 seconds. Just reset. So I got about 10, so it's normal rate for respiration. And you want to do it too when when you're doing oxygen level, because a lot of times if you just tell them, oh, I'm going to watch you your chest, they're either gonna try and not breathe as much, or they're gonna breathe heavier, so you wouldn't always get an accurate reading. And then the next test we're going to do is oxygen saturation. So in order to do an oxygen saturation test, you would place the pulse oximeter on the pointer finger, and you want to get a rating about 95 and above is normal oxygen saturation. Anything below 85 is severe hypoxia, which you don't want. So you'd place the pulse oximeter over their pointer finger, and it would give you a clear reading. And you want to make sure when you do it that the client does not have any nail polish or press-on nails, because this could interfere with the rating. So if your hands are really, really cold, that could also interfere with the rating. And then the last assessment we're going to do is a pain scale. So a pain scale would normally be on a scale of 1 to 10, 10 being the highest amount of pain you can feel, and 1 being like no pain at all. So do you feel any pain?
No, I don't feel any.
No. And then so if he doesn't feel any, which is good. And if they did have any pain, you would want to mark down what their level they're assessed is, and then just clarify with them how much pain they're feeling. Thank you for helping me.
You're welcome.